So we come to the sort of crux of the matter now, how to diffuse or how to manage a potentially difficult situation. And I would think that most of you have heard of or been involved with a situation in which it has been difficult to manage, you're not sure what to do. The slides deal mostly with the sort of angry individual who goes from being calm to being fairly hostile and in a rage. But obviously from your comments, there are multiple situations that don't involve hostility or rage, that may involve many other things, whether it be anxiety, whether it be just can't focus and is perhaps a bit disruptive, mostly to him or herself. And so in most situations, we have this triangle in which there's a thought about how we interpret things are, how we perceive things to be, not perhaps how they truly are. So in a case in which something has been stolen, for instance, the obvious thought would be, you've deliberately hurt or threatened me, I'm going to take revenge, maybe steal something from you, which would be the behavior consequent to that. Of course, in the angry individual, you would see a clenched fist, jaws tightening, etc., red face. And the emotion may vary. It may range from being somewhat irritated, depending on the situation, to outright hostility, rage, where there might be a physical altercation. And the situation depends a lot on the individual and what the individual comes into the situation with. And as we have mentioned, there might be several triggers. There can be psychiatric illness, substance use, physical pain, medical conditions, insomnia, a genetic predisposition as well, a prior history of violence or child abuse can all be potential traits and triggers. Interpersonally, how well do we communicate our feelings to one another? I think many of us are sometimes very poor in experts at doing that. We either lack the ability to communicate well or we miscommunicate how we feel. We also come into situations with different expectations or attitudes. I may value my privacy. I don't like people talking to me when I'm alone. And then the unresolved conflicts. So the lady who was just here mentioned a group that travels together, but they would all go to the one out of the code program. So obviously they get on well, and hopefully they have a dynamic in which they can resolve situations. And then you have other individuals who don't have that group and perhaps have a difficulty in resolving conflict. Then environmentally, we have, of course, the scant resources. Everyone is fighting for survival, so resources are scarce. Crowding can be an issue. Right? If you are closely packed like sardines and your physical space is then encroached on, that can be an irritating condition. Too hot or too cold, we know when we're in our office space, somebody is always complaining, turn the heat on, it's too cold in here, or where's the air conditioning, it's too hot in here. So all of those potential conditions can trigger an angry situation. We have on this side of the curve, going from calm to a trigger to agitation, anxiety, and at the top of the curve, hostility and rage. And on the other side, the downswing, we have the de-escalation and the recovery calm phase, which won't be sort of unknown to you. This piece is also probably unknown to you, that when we are calm, we can hopefully think a bit more logically about situations and problem solve. When we are in an enraged state, how well do many of us problem solve situations and can talk about things? It's difficult, much more difficult to be logical and problem solve. So body language is important, that our actions really speak much louder than our words. And we know from research that 55% of communication is really through our body language. whether you're looking interested right now, whether you're looking half bored and thinking, oh my gosh, the time is going so slowly, and when will I get out of here, right? From your facial expressions, I can perhaps guess a little bit about those sorts of things. So it's really a question of being aware of how we are portraying ourselves. And that has been mentioned. It's difficult to be happy when you yourself are not being happy. It's difficult to feel calm and to portray calm when you yourself are not portraying calm. It's a bit like a mirror image. If I smile, I saw you smiling in return, and you as well, right? There's an automatic kind of response in others to do the same thing. And our body language certainly incorporates all of these things: voice, facial expressions, gaze, posture, touch, use of space. So I have a couple of non-verbal language do's. So posture. I did some training several months ago, but this was for like a crisis situation at work with clients. And there was the stance that they suggested that we adopt. So a couple of things, the people who were training were not in law enforcement or what have you. They had done the training, but they had said that one should have this sort of stance, right, at an angle to individuals. Never be sort of face front, right, because you're much more open to attack and you can't sort of move as easily, right. So kind of an angled stance. Obviously, when we present ourselves, we need to know how we are presenting ourselves. And it's funny, all of a sudden the other day I noticed I have these furrows in my brow. When did those appear? Obviously I've been frowning way too much for my liking. And so I thought, I've got to do something about that. So now I'm trying to smile, really be conscious of having, maybe not a full grin, because then I will look quite odd. But still, having a pleasant smile on our face never hurts anybody or anything. And again, some people are naturally quiet in terms of their voice. Some people are naturally louder in terms of their voice. And how does that come across to the individuals who you see every day? If I speak quietly to you, sometimes that might be interpreted as, you don't know what you are talking about. I have to strain, you're not being polite. Speak up, be louder. And if I'm too loud, that may also be threatening. It can also be hurtful as well too. And the sort of second to last bullet says, give appropriate personal space. And we all individually know for each of us, what that appropriate space is. But I think for the guests who come through your doors, that space may need to increase a tad. So I think that's when you listen and you observe and you note how is the person reacting to your physical presence. Is the person backing away from you, right? Putting up walls, saying you've come too close to me. Right? So I would take my cues from the other person. And listening is so wonderful, and obviously you all listen very well. And then there are some verbal do's. Again, use the person's name, conveying respect. Use open-ended questions. I think no one likes to be told what to do, regardless of your situation or status in life. All of us, I think, prefer to be invited to do something rather than to be told to do something. There are always exceptions to rules, and the exception, of course, is if there is immediate harm or threat of potential harm. Then it's more a matter of doing, as I say, rather than inviting. You can still invite, but again, I think you need to use your judgment in those situations where the rules of safety come first. Validating is also an important ingredient in listening and conveying empathy. So it's hard to be here. It's difficult. I understand, you need to wash your hands 1,000 times because of whatever the reason, you have heard. And conveying empathy also involves asking what people think about things, because everyone who comes through has a thought, an important thought, that may not have been heard for a while. And so you might be one of the few people to hear those thoughts. Clarify communication when needed, and humor I find to be often a very useful thing to use, but in certain situations it can be interpreted quite wrongly, and so I would use it judiciously and carefully. If you're more familiar with individuals and you know them better, then for sure you can use your sense of humor, and if not, then I would be cautious about doing that, because again, culturally it can be interpreted wrongly, and based on what they have experienced can also be misinterpreted as being offensive. And I'm sure you never say these things, as in calm down and calm down now. Again, no one likes to be told, right, in such a harsh way what to do. Calm down or else, which is an implied threat. Okay. Or, you know better than that. You've been here long enough. Another implication of being somewhat degrading to the individual. So observation, preparation, approach, action, and follow-up. Okay. So in that sort of bell curve slide, we had the initial stage of being somewhat anxious, okay, where the person might be up and around, maybe mumbling to him or herself, being somewhat unfocused, wandering even, maybe saying things, maybe not saying things. Okay. And what would then be your sort of next steps in terms of preparation? So I have up there, sort of consider the causes. So what is prompting the behavior, you think? What do you know about your guest to kind of evaluate the situation? Do you need to turn to somebody else for assistance in helping to evaluate the situation? There's a report, yes, that, and how well documented would be the report, I guess?
Well, there'll be the communications report from that night will show whether that guest has had a observable issue on a previous shift or not, or whether it's brand new. The person's just starting to be anxious.
To be anxious, yeah. And not all anxiety is certainly outward. For a lot of people, pacing is present, sort of being restless and up and down. For others, it might be twiddling, their thumbs, and sort of ruminating in their minds what's going to happen, what has happened, what will happen. So not all anxiety is external and behavioral. So if you did see someone who though is sort of agitated, is up and about, the approach would be, call the person by name, approach from the front. There is, as my friend back there from the law enforcement would suggest, approaching from behind is always threatening to individuals. No one likes to be surprised from behind. And offer to have a conversation or to chat with the individual. Listening is important. Asking guests to make a choice about the behavior, I think, is critical. Would you like to do this? I see you having some problems. You can take a break outside, have a coffee, have a chat, what have you. And then follow up. You need to write your report, check in with the guest afterwards, continue to observe the behavior to ensure that there is a calm sort of recovery phase that he or she has engaged in. The hostile phase and the next phase, the rage stage, are obviously potential for a crisis situation. And again, you may have the guest yelling, swearing, shouting, being disruptive without actually physically doing anything. We've talked about exits, and it's always important to know your nearest exit. I think it's also important where you place yourself with regards to the nearest exit, so you don't have the guest, and in this stage and the next, you don't have your guest between you and the exit and your escape route. So know where your exit is, have your back to the exit rather than your front so you can quickly escape. if needs be. Obviously, removing others and potential weapons are also essential. Again, using the person's name, and then the actions. Setting limits, because you do have limits within your settings, but being respectful about how you set those limits. Offer alternatives to the behavior. And emphasize with feelings about the behavior, not about the person so much. So it's more about, I understand that you are angry, as opposed to, Joe, you're being very angry right now. I don't like that when you're angry, sort of idea. And then again, your follow-up is to observe, check in with the guest, do notes, and help others who may be affected.
Suggested at the hostile stage, we obviously want to be very explicit about giving the guest a choice. So here, it's, Joe, we cannot have this behavior continue. It's upsetting the shelter. You understand that that's a problem, do you? Or can you see what's happening here? So I need you to make a choice. I need you either to take a deep breath, go outside if you need to for right at the door, but I need you to calm down and make this work for yourself. Because if you don't, you're going to have to leave. Do you understand that, Joe? Okay. So what would you like to do? And how would you like to? Is there anything you need to do to calm down? Would you like to sit with me for a few minutes? Do you want to have a tea with me? And we'll just chat about what's going on. But at the hostile stage, there is no option. We must give them the choice because it cannot continue, right? And it has to be that clear, that black and white.
And if I may comment then on Gary's presentation of that, because I think it's also important. So how would you, in your minds, can you adopt Gary's presentation? Because in a sense, I think that's how he is portraying, as if he was speaking to the guest in front of him. So are you comfortable with being that assertive? Because not all of us, again, are that assertive, especially in confrontation with a hostile individual. And if you haven't confronted that situation before, there's practice that's needed to do that beforehand. So we don't kind of fumble our way through. The other point I wanted to make is these appear to be discrete events, and sometimes they're not as discrete as they are on a slide. So the person may start off being hostile, angry, yelling, etc., etc. And you may approach and say those sorts of things that Gary has pointed out, and the person may go from being hostile to being enraged during that conversation with you. And so, we think that they are discrete events, but sometimes they're not as discrete. And so your response after that is also important to consider. So I approach and I, say this is unacceptable behavior. In essence, these are your options. Right? And if the person chooses to take an acceptable option, then fine. If the option is not what you would like, then what? So there's also the preparation on your part for what if the person then escalates the behavior, which would be sort of this next phase, right, of immediately calling for assistance and making sure that everyone is safe. But that hijacking of problem solving, when blood is rushing to your head and things that get all confused, people are fairly incoherent. Typical, normal, coherent, logical thinking people can be hijacked by anger and other emotions, for sure. And it can be difficult to engage in a conversation. So the conversation, I'm also pointing out, don't give too many options, because that's also confusing, right? 2 would be great, do this or that, for instance, and be clear and direct in your communication.
We have called the police several times from our shelters. This is not an unusual thing. You may have been involved with this in the past. And it's not anything we should hesitate to do, right? Mm-hmm. This is not your failure. It's not, gee, I wish I'd done this differently, or if I'd only tried this approach. Don't worry about that. That can happen later, your sort of evaluation. What you're concerned about is your own safety, yes, and the safety of all the other 34 guests that are there. And you really don't want it to turn into something that becomes unmanageable. So we need that one guest to be neutralized, if you will, so we can keep the calm in the rest of the shelter. Because we had we've had an incident last season where the police were called, not on a 911 call, but on a request to come in and talk to a guest. And we meaning the leadership team involved, wasn't very explicit as to what was the nature of the problem. And the way the police dispatcher took it was, well, this is kind of a optional thing. The shelters, they're a little bit worried, but they're not terribly worried. Well, in fact, the volunteers involved were worried. And of course the police took their time to come because they didn't see it as a big deal. And so our volunteers became upset and thinking, oh, this is an example of terrible police response, and where's the cooperation, blah, blah, blah. So we got this back as your team, as your leadership team, that police not responding fast enough, not taking the right attitude, blah, blah, blah. We go back to our liaison at the Barrie Police, and say, well, here's the problem. They go back to the tapes, because they're all recorded conversations, and they say, hey, we've gone over this conversation from your volunteer, and they, the words were not, please come urgently, or this is a real problem, or we've got a situation. None of that language was in the call. So we thought it was just one of these kind of walkthrough things you guys want us to do sometimes. So when you really are approaching hostile rage and it's not working, the strategies aren't working, then you do need to probably remove the guest through a police call. And that's, that you want to be explicit. We're back to using 911, make it clear what's happened, that you want a police response quickly to remove a guest. So you probably have some questions following this information from Dr. Maing, and we'd encourage you to ask questions either from your shift team leader colleagues or from your coordinator, for example, or perhaps you'd like to send your question directly to us. You can do that at info@barrieoutofthecold.org, or use the telephone number that's provided at the end of this video. But do ask questions. Remember, the only dumb question is the question that's not asked. Let's look at a couple of scenarios where we can apply this new information and insight. The first one, it's 8:30 p.m. Jack, an older guest, has been having a rough night. He's pacing the floor, constantly going outside for a smoke, and appears to be irritating other guests. What stage is he at, and what should you do? Why don't you pause the video now, think about your response, and let's come back to it. In terms of the stages of escalation, we might agree that Jack is at the anxious stage. We've observed that he's pacing the floor, he's going outside constantly, he does seem to be irritable, and he's irritating other guests. Therefore, an intervention of some kind is required. As far as preparation, we might check the report, see if the previous shift had noted any issues with Jack, talk to our team members, particularly team or shift leader, talk about a potential approach that we should make, but generally get ready to have a conversation. The approach itself, we probably come from the front, take an angled posture, call Jack by his first name, ask some open-ended questions like how is he feeling, make it clear that we've noted that he's feeling anxious, and then suggest that perhaps he'd like to sit down, have a cup of tea, conversation, try and open him up to the idea that being calm is what he wants to do as well as what we need him to do for the sake of the shelter. Hopefully that works. After that, we might make a note in our report and generally observe and follow up to make sure Jack is remaining calm. Okay, it's 10:30 p.m. Jack's quieted down, but another guest, who he annoyed earlier, appears to be picking an argument with Jack. Jack's taking the bait and appears ready to explode. Nearby guests are taking notice. What stage are the guests at, and what should you do? Why don't you pause the video and determine what the appropriate response should be. Okay, the first thing we've noted as part of our observation is that there is another guest involved in addition to Jack, plus the rest of the shelter. And therefore, as part of our preparation, we'll want to involve other team members, our shift or team leader for sure, put a strategy together, probably to separate
Jack and the other guest and a team member to deal with each one of them. As far as Jack's concerned, we certainly want to approach again, angled stance, call his name, invite him to sit down, and give him a clear choice early in the conversation that he would need to calm down, would need to start to de-escalate his behavior, or we're going to have to ask him to leave the shelter. Certainly we would want to recognize, be empathetic that he has been baited perhaps, or the other guest has been upsetting him, acknowledge that. We aren't going to take sides. We're simply going to focus on Jack and to underline with Jack that he needs to de-escalate his behavior, he needs to calm down and help him do that. We can ask questions, open-ended questions. Again, invite him to have a cup of tea. But the choice to Jack should be made pretty clear that we need calm in the shelter or he'll have to leave. Hopefully that does the trick and Jack accepts that. We might, as a follow-up, separate the two guests, make sure Jack is not sleeping, for example, next to or close to the other guest that's causing the problem, and certainly observe both guests to make sure that calm has been restored. Part 3. Jack's gone very quiet and he shuffles off to the washroom. A few seconds later, the fire alarm begins to sound. What should you do? Why don't you pause the video and decide what would be the appropriate response. Okay, there's only one response in this scenario, and that is to evacuate the shelter. So without hesitation, you should go to the guests who are sleeping, wake them up, ask them to get their coat and shoes on, and to get them out of the building and to assemble at the agreed meeting place. There's one agreed meeting place for each shelter, and that's something you should know from when you first checked in on your shift. You may be asked by your shift or team leader to pick up the guest sign-in sheet or the volunteer sign-in sheet and perhaps check the washrooms, do a sweep of hallways to make sure there are no guests left behind. But only outside would we generally then call 911. In fact, most of our shelters are hardwired into Barrie Fire Services in any case. At that point, you might be asked to do a head count against who should be in the shelter, but as I say, the priority is to evacuate. Our last scenario is that sometime later, Jack has taken up a knife, is pointing in the direction of another guest, and is approaching the guest, swearing at him. What stage is Jack at, and what should you do? Pause the video and think about your response. Jack is clearly at the rage stage. This is a difficult situation for the shelter to be in. We are not trained in disarming procedures, so the most important thing is to keep you and other guests safe. So, generally speaking, we would want to instruct one team member to call 911 with an urgent call for assistance. While you attempt to engage Jack, again keeping in mind that angled stance, exit at your back. We also generally want to clear other guests out of the immediate area, right? So there's as little distraction as possible or little potential for other engagement as possible. Actually getting guests out of the shelter behind you, for example, would be a good idea if that's possible. And generally to engage Jack in conversation. So can we talk to him? Can we ask him open-ended questions? Can we try to use calming procedures to try and calm him down? Always keeping in mind that if Jack were to lunge at you, that you would be able to back out of harm's way safely. Aside from that, we need to wait till the police arrive, who are the professionals, and they will deal with the situation. But again, your safety and the safety of our other guests and volunteers is our primary concern and should be generally kept out of the area. So thank you for taking the time to review this video and related materials. We hope it's been useful. My name's Gary Lyon. I'm Director of Training, and we love to answer your questions. First of all, do ask your shift team leaders or coordinators. They can help. Consult the operations manual at your site. But if that isn't enough, do call us, 705-331-1396. You can leave a message or reach us at info@barrieoutofthecold.org. We hope you have a great season, and keep in mind the two most important tools that you have available to you are your ears and eyes. Please listen, please observe, be vigilant, be safe, and have a great season. Thank you again.